It's the biggest source of disability, depression, anxiety, and the whole spectrum of mental health disorders, the disease of despair. And partly it's related to our diet and the lifestyle, environmental toxins, and how those influence our genes. But also there are interesting genes that you see pop up. For example, there's genes that look at dopamine receptors and appetite regulation that make it clear, like, well, why does this person like binge on this stuff, or why does this person can't control their behavior? Why are they so addictive? Why? And I'm like, well, I could never eat a whole sheet cake, but there's some people that can eat a whole sheet cake. I just it wouldn't happen to me. And they have different genes, and it's just fascinating to see this. And it actually maps out when I take their story as a doctor. I take their medical history, and then I see their gene. I'm like, oh, this makes sense. It's sort of interesting. I had somebody actually yesterday that was just like that. And I was like, wow, this so makes sense.
It's fascinating. I had a patient and she was struggling with her weight. She had gained like 40 pounds, and her obesity panel, because we divide things into panels. So there's cardiac disease, diabetes, obesity. Her obesity panel wasn't that bad. And so then we opened up more of her mental health report, and she had tons of genes relating to addiction and high glutamate and high dopamine, and that will create different behaviors. And I was like, do you by any chance think you might have a food addiction?